Hospital patients and long-term care residents spend an awful lot of time in their room. Hi, I'm Kathy Getrist, and today we're going to be talking about the patient's environment. The patient's environment or unit is the room that contains the patient's belongings and sometimes their furniture. The size and layout of the unit depends to a great extent on the type of health care the patient is receiving. For example, the patient unit in a hospital situation might be rather small and bare in comparison to the long-term care unit where the person is going to be spending the majority of the rest of their life. That would be more home-like and more personal. Age, illness, and activity all affect comfort. So do things like temperature, the ventilation system, noise, odors, and lighting. These factors can be controlled to meet the person's needs. Healthcare facilities have heating and air conditioning systems and ventilation systems that maintain a comfortable temperature and provide fresh air in the room. For those of us in our home or apartments, a comfortable, healthy reading for a temperature would be somewhere between about 68 and 74 degrees Fahrenheit. Infants, the elderly, and those that are ill frequently will need warmer temperatures than that, however. And you probably are aware that older people, because of the circulatory problems, tend to want to dress more warmly than those of us that are more active and younger. You'll see them having lap robes on their waist or on their lap while they're sitting up in a wheelchair, or putting on sweaters when it seems perfectly comfortable for us. As a result of this, healthcare facilities, particularly long-term care settings such as a nursing home, may have a temperature reading that's above the average of 68 to 74 degrees. Stale air and odor also affects comfort level of an individual. A good ventilation system can provide fresh air and moves room air. Ill people are sensitive to noises and sounds around them. Sounds such as banging of bedpans and utensils with trays, buzzers going off, loud conversations in the hallway by healthcare workers, all are unfamiliar sounds to the resident. And it might be disturbing to them. What might seem common to us in that setting may be new and even frightening to an individual that's in one of the patient care units. Things such as you might have a resident that yells out periodically. You could have somebody that moans in their sleep, or any number of unfamiliar sounds, buzzers that are going off, all things that are unfamiliar to an individual, and it's your responsibility to help them feel safe and secure by giving some meaning and what the cause of that particular noise might be. Healthcare facilities are designed to reduce noise. For example, the draperies in the room, carpeting helps diminish noise. Many of the old-time aluminum, stainless steel wash basins and bedpans have now been replaced by plastic, which do cut down on the noise level. Promptly answering phones and intercoms will help decrease noise. Never turn a television on in a patient room or turn it up unless it's the patient's request. I've known of situations where caregivers have gone in to care for a resident and flipped the television on and immediately got to their favorite soap opera, maybe Days of Our Lives or whatever, to see the latest episode. This is not appropriate. The time that you're in the patient unit should be focused on interaction with that individual resident. Many odors occur in healthcare facilities. Some of them are pleasant, such as the smell of food or the scent of some fresh flowers, but some can be very unpleasant as well. Things like bowel movement, urine, vomit, a draining wound, all can cause very unpleasant odors. Ways that you can help reduce those odors are to promptly clean and empty and clean any waste from a bedpan, change soiled linens and briefs that the individual might be wearing that would be soiled, clean any incontinent resident thoroughly with soap and water or a special peri-wash solution to help cut the odor, and generally provide really good personal hygiene so that the patient's body and their breath have a fresh and pleasant odor to them. Good lighting is also needed for comfort and safety of both patients and staff. Shadows, dim or glaring lights can cause problems such as falls. It can cause headaches and also eye strain. It's important that you adjust the lighting to meet the changing needs. For example, pulling blinds or drapes in the room if there's glaring bright sunlight coming in. The overbed light, that's the light that is right above the bed, has an adjustment on it so that it can have soft, medium, or bright light. And when you are providing care, you probably are going to want to have bright light on so that you can accurately see what you're doing. Make certain that the individual has the signal that allows them to adjust the lighting to their comfort level once you've left the room. Protecting the patient's safety is at the center of all of our healthcare delivery. A safe unit is one that is arranged such that there are not accidents that occur. That means all equipment that you are working with needs to be in proper working order. Be sure that if you find a wheel that does not look like it's on correctly, or it's wiggling, or a part of a wheelchair is missing, or any other thing that might go wrong with a piece of equipment, notify housekeeping or the nurse so that that can get corrected and prevent an accident. Always keep the signal cord within reach of the patient. What happens sometimes if it's not within reach, they may need to go to the bathroom, and they will get up on their own if they can't reach some assistance, and in the process may fall, and a prevention of that could have occurred if the signal cord had been easily accessible to them. Be sure that the area where the patient is neat, clean, and uncluttered, not only for the patient's sake, for staff and visitors as well, to be able to maneuver around and not fear of tripping over cords or over waste baskets and so forth. Safety bars and emergency call systems are provided in the bathrooms and also in the hallways, and make sure that your patients are aware of that and know how to use them. The bed is always positioned closest to the floor when care has been provided and has been completed. The bed is able to go up horizontally and should be raised to a comfortable working height for good body mechanics while care is being given. But once it's completed, you always have the bed placed in lowest position so that if the individual is trying to get out of bed, their feet can reach the ground safely. Also, be sure that wheels are locked when not in motion. That means the wheels on the bed, that means the wheels on a walker, or the wheels on a wheelchair. When the patient is not using them, they should be locked, or if they're going to be transferring from, for example, a wheelchair to the toilet, be certain that the wheels